Hi everyone, my name is Navneet Bains and I have developed a Pecha presentation for the course PIDP 3240 for assignment number 3. I will be talking about how using case studies in nursing school can help students utilize their critical thinking, collaboration, and problem-solving skills. Being an educator is important as it helps mold students into well-rounded nurses. I believe teaching should be learner-centered to guarantee students are achieving the goals they want to attain, which also ensures they are invested in their learning as active contributors. The learning activity that I will be talking about would be using a case study on a post-operative patient. Sharing power and creating meaningful relationships with students is what I strive for as an educator, and therefore the caring theory is my personal vision for teaching. The caring theory is particularly important with first-year nursing students as they may have limited experiences in nursing. Building a foundation for caring for others, providing support, and establishing a true relationship is important for these nurses. There are concepts that are built upon in different levels of the nursing program, so starting early to instill these concepts is important. The concepts of critical thinking, communication, collaboration, problem solving are essential in first-year nursing students. Critical thinking in nursing allows students to think more in depth about situations. Critical thinking is essential for students to make appropriate judgments and nursing interventions to ensure the highest quality of patient care. Being able to think critically improves the ability of cognitive thinking skills in clinical analysis, judgments, and decision-making skills, and problem-solving skills, and ensuring the patients are safe. Communication is important in order to build meaningful and therapeutic relationships with others. Being able to effectively communicate with patients and other healthcare team members in order to build relationships is important. Students at the first-year level can practice with other students, and this could involve introducing themselves as student nurses and asking patient questions about their health. Collaboration is also an important part for students to learn as nurses, as they are constantly working with other healthcare team members and patients. Students working towards a common goal with others to create what they want to accomplish and determine how to get there is an important part of collaboration. Learning outcomes for students would be to 1. The learner would be able to apply critical thinking skills by analyzing information and problem-solving skills through situations and activities. 2. The learner would feel comfortable applying communication skills with their patients and other healthcare team members by introducing themselves, asking patients questions about their health. 3. The learner will be able to reflect on their nursing practice to identify their strengths and areas for further improvement. 4. Their learner will be able to discuss information with other healthcare team members to improve patient care. Case studies allow students to look at the whole picture of a patient. It involves determining what to assess in patients, conversing effectively with other students to discuss the scenario, and collaborating with others. Students would work together to determine what course of action to take in the scenarios, which would ultimately affect patient care. The caring theory discusses involving caring for others, problem solving using a caring process, and maintaining supportive relationships that creates an optimal learning environment. Overall, case studies reflect critical thinking skills because they involve looking at different aspects, looking at the patient holistically, and thinking about what could be happening to the patient and figuring out what to do for them next. This process can be transferred into clinical practice. Using the caring theory, students are taught to analyze information and to look beyond the information that is given to them to discover essential data. Students work together with one another to discuss the situation, gather data, and analyze it, and agree on a course of action together. The case study involves a patient being admitted to a medical surgical unit after having a bowel resection. She is post-op day 2. It was noted from the previous shift that there was small amounts of shadowing to her dressing. You go to introduce yourself and she is guarding her abdomen. When asked how she is doing, she is very uncomfortable and has been having a lot of pain. The following are the questions the students would answer. 1. What will be your focus assessments? 2. What questions do you plan to ask the patient? 3. What are some factors influencing her situation? 4. What are the various resources or methods you could use to gather data? And 5. What are your concerns and possible nursing diagnoses for this patient? Factual, conceptual, and metacognitive knowledge are applied during this case study. Strategies of peer learning, a flipped classroom, and problem-based learning would be used during this case study. For a flipped classroom, students would be responsible prepare at home by learning about common surgeries on the unit, secondary diagnoses, and postoperative complications. When discussing the actual activity, peer learning is used by students sharing their knowledge they have acquired on the topics. Students could also use their experience they have gained so far during the learning experience, but they may not have a lot due to being first-year nursing students. This is a group activity and involves students working together and having discussions. As an educator, I would listen to students and the ideas they come up with. If they do not consider certain aspects of patient care, like pain and potential problems the patient may be having, I would guide students to prompt further thinking of the situation without too much involvement to ensure the activity is still learner-centered. A way that I could evaluate learners' achievement of the objectives is by listening to the types of questions they are asking during the discussion and the types of answers they are giving. Another way that I could evaluate students is through critical reflection. They could reflect on the case study and determine how well they did and what they think they could improve on as a way of learning. Another way of evaluating students' thinking is through concept mapping. When the students and I are done discussing the case study, students can individually construct a concept map to link together the ideas we have discussed. This would help achieve their learning goals by students connecting ideas together and understanding the relationships between information. As an educator, I would want to see if these case studies were effective so I could evaluate myself and get feedback from students to see if this learning activity was beneficial to their learning. The feedback could be anonymous. In conclusion, the learning activity I chose is a case study that is derived from the learning theory of caring by Watson. The concepts of critical thinking, communication, collaboration, and problem solving are areas that are covered in the case study, which would help students become more comfortable with the scenarios they may encounter in clinical practice. These are the references that I have used for my PowerPoint to back up information that I have used throughout my presentation. Thank you for watching my Pecha presentation, and I hope you have learned something.